Hi, my name is Michelle and I'm 45 years old. So I raised my children as a single mom. After the divorce, I had lost a lot of weight. Unfortunately, the one area I could not lose the weight was my stomach area. In raising my children, the one thing that was most important was making sure that they had a roof over their head, food in their mouths, and a lot of support. And although I was very self-conscious about my stomach, it wasn't a priority based on where we were at financially. A girlfriend of mine actually had a consultation and asked me to take her. When I saw what was going on, I realized that it wasn't about vanity. It was about feeling good about yourself and who you were inside. And I felt so bad that I criticized her and ridiculed her for wanting to do these things. Culturally, where I come from, that's one of the last things you think about. You think about your family first, you think about your children, you think about trying to get them to that next level that you weren't at. I always had them in activities every season of every year. I was the team mom on every single team. I was there on every Saturday for the young Marines. So I was always active in my younger years, but it brought me back to that point because there were many times where I was on the field during practice. I'd spend an hour going around the track and I started walking. On the swim team, they were swimming and I didn't know how to swim. In the dive pool, just down the way from where they were, I was kicking with a kickboard. And then I taught myself how to swim. So I signed up for an Ironman. An Ironman consists of a 2.4 mile swim, a 112 mile bike ride, and a 26.2 mile run. I would get up at 4 o'clock in the morning, I'd do my training, I'd leave, I'd go to work, 12 to 14 hours a day with the type of athletic wear that we have to wear, being bent over in aero bars for an extended period of time, 4, 5, 6 hours on your bike seat, and then you're trying to pump your legs to be faster or stronger to climb a hill, and there's this thing in the way. It really is just like this mass in the middle of your belly. When I talked to Dr. Nichter and I found him, that was one of the things we had to discuss. It was how quickly will I recover and what things do I need to do so that I can get back in the water right away, get back on my bike and start running. I wasn't sure how much a difference it would make until after the surgery when I was ready to get back into training and I sat on my bike and I had to get refit because it was just so different. What was most amazing after the surgery and being able to put on normal clothes was the feel of the clothes around my waist and my hips. And I practically cried when I put a bathing suit on for the first time because I hadn't looked like that in 20 years.